Hi, my name's Tanner. I'll be your student nurse today. Can you tell me your name and date of birth? It's Wendy Smith, 2/13/1950. Perform hand hygiene. Check your orders. Okay, Miss Smith. Looks like we'll be giving you some aspirin through your NG tube today. Do you have any allergies that I need to know about? She has no allergies. Okay, I'm going to check your tomorrow over here. Put some gloves on. Yeah, it looks like we're giving you some aspirin today, 325 milligrams. Before giving any medication through the NG tube, I would make sure and check the placement. By injecting air. And listening for the bubbles. Okay, here's some bubbles. So we know that placement is still good. Also, we can make sure the measurement is still in the correct place. Now I'm going to make sure that the medication I'm giving is able to be crushed and given through an NG tube or PEG tube. Give a cup. Make sure not to touch the actual medication. I'm going to crush the medication. Oops. Get the medication crushed as fine as possible. Before administering the medication, I'm going to get some water, 30 milliliters of water, to flush the NG tube or PEG tube to make sure that it's not clogged before I give more medication. Okay, it passes well. And then I'm going to combine the crushed medication with water or whatever is preferred on the bottle, with some water. And I'm going to slowly give it, making sure that the tube doesn't become clogged. And if it was a PEG tube, I could also take the plunger out and let gravity allow the medication to be administered. And I get another 30 milliliters of water. To flush, once again, making sure that there's no leftover medication, crushed medication in the tube. Okay. Replace the cap. Before giving the medication, I would also perform my 5 rights and 3 checks. Then before leaving the room, I could recheck the NG tube placement to make sure that it didn't get moved during the process. I would lower the patient's bed and make sure their call light was in reach, and make sure I document the medication that I gave. I'm going to show them the landmarks for the different injection sites. First I'll show ventral gluteal. Find the process right here. And you make it's kind of shaped like this, and then you spread these fingers away from your forefingers to find the correct injection site, which is right around here. For the vascular you look for the middle third and then on the side, and you could use the Z-track technique to give an injection there. And then the deltoid, you find the process up on your shoulder, and then depending on the person, you can come a few finger lengths down depending on the size of your fingers, and then give it in the deltoid. It's just like a triangle shaped area. And then for your sub-Q sites, you can give it in the back of the arm, in the fatty or more tissue area, or make sure you bunch up some skin. Give it at a 45-degree angle to make sure you don't get into the muscle tissue. And then the other sub-Q injection site is the abdomen, and you just want to make sure that you go in at a 45-degree angle and you stay at least 1 inch away from the umbilicus and rotate your injection sites.